Alright, so I'm going to verify my order. I have a lot of followings here. 105XX, allergies, segment coding. All for morning meds have been given. One due now is cephaloxolin, 1 gram, IV piggyback times 1 now for infection. So I'm going to go ahead and go to the fixes. I'm going to wash my hands. Glove up. So I have a lot of followings here. 105XX, allergies, segment coding. We are not giving any of that. So we do have a cephaloxolin. 1 gram IV piggyback times 1 now for infection. So I'm going to go ahead and pull that out. I'm going to do my first check. So cephaloxolin, 1 gram. This one expires 2052. It's not expired. Clear, no sediment. So I'm going to go ahead and remove my gloves, wash my hands, and go to the nurse's station and prepare this. So at the nurse's station, I'm going to go ahead and wash my hands, glove up. And I'm going to prepare my medication. I'm going to go ahead and do my second check as well. So I have a lot of followings here. 105XX, allergies, tagamet and coding. And then, so we have cephaloxolin, 1 gram. This one expires 2052. And I have gone ahead and checked to see if she does have sodium chloride running, and it is compatible. I've checked it with the medication, so I'm going to go ahead and prepare my med. So we have secondary IV set here. It is 15 drops per ml. And since we don't have an IV pump, I have done the medication math. It is 50 drops per minute, so it equals around 13 drops per 15 seconds. So I'm going to go ahead and spike my bag. I'm going to go ahead and spike my bag and maintain sterility. And I'm going to make sure it's clamped. Alright, and then I'm going to go ahead and bring my alcohol swab, and I'm going to go ahead and label my IV tubing. So I'm going to initial date, which is 4/22/20, and then it is 8 a.m. symptom. So I'm going to go ahead and label this. And I'm going to remove my dirty gloves and then wash my hands. I'm going to go ahead and go into the patient's room. So in the patient's room, I'm going to knock, provide some privacy. Hi, Miss Lotta Follies. My name is Selena. I'll be your student nurse today. I came in to bring in your antibiotic that the doctor has ordered. Are you able to tell me your name and date of birth?
Lotta Fallings,
Okay.
105XX.
Perfect. Do you have any allergies?
Codeine and tagamet.
Okay. What happens when you take codeine and tagamet?
I get rashes.
Okay. We are not giving you any of that right now. So I'm gonna go ahead. I'm gonna do my third check for my medication, and I'll be right back. So here I would have had washed my hands, put on gloves, and here I'm gonna do my third check. So I have cephaloxolin. 1 gram. It expires 2052. It's for Lotta Fallings, 10-5, and we verified her allergies as well. Alright, Miss Lotta Fallings, so here I have cephaloxolin. It's an antibiotic to help fight the infection. Some side effects can be GI upset, stomach ache, diarrhea. Some allergic reactions could be hives, rash. So just let me know if we do get that. Are you okay with taking this medication, or do you have any other questions?
Yes and no.
No questions?
No questions.
Okay with taking it?
Yes.
Okay. So I'm going to go ahead. I'm wearing gloves, and I'm going to go ahead and inspect your IV site. I don't notice any redness or swelling. Do you have any pain with that?
No.
Okay. So I'm going to go ahead and scrub the hub for 30 seconds. Okay, time has elapsed. And here I would sterilely connect my secondary tube with my primary tube, but I got the line that does not allow that. But here I would have unclamped, and I would have done the backflow to prime the line to get rid of all the air bubbles. So that would have been completed. and I would clamp that, clamp the primary tubing, and hung it lower than our secondary infusion. Alright. And then here I would have made sure it was half full. So this one's closed, and then this one I would open and set with my watch the 13 drops per 15 seconds. So here. Alright, so here we have set the appropriate drip rate of 13 drops per 15 seconds. So this one would be dropping and this one is clamped, so this one's not going. So, Miss Bottle Fallings, I'll be back in 30 minutes to come check on you or call me in the meantime. Once this infusion is complete, this one, I will clamp it to stop the primary infusion, and then I would I would open this one, your primary line, and set it at the appropriate drip rate. So I'm going to go ahead and go document. So I'm going to remove my dirty gloves, wash my hands, and here I would document the medication I gave her. So here for Bottle Fallings, I gave her cefazolin, 1 gram IV piggyback 1 times now at 8 a.m. So I would cross that out. My initials, and it was on her left arm, and here I would sign my name, credentials, and then initial, and that is all.